For InteractMD.com, this is Dr. Michael Benjamin. Thursday, February 4th, 2010. Today's topic, radiation and CT scans. You may remember the story circulating in December of 2009 when it came out that Los Angeles area hospitals were providing too much radiation with head CTs. Patients were complaining that their hair was falling out with CT scans, and investigations were conducted, and sure enough, some hospitals were delivering too high of a radiation dose with the CAT scans. As it turns out, there are lots of variations in technique with CT scans, and the problem is that not every patient is the same, so technicians have to adjust the doses according to the patient's body habitus or the type of exam being done. And the problem is also, once one set of parameters gets programmed into the scanner, they have to be changed periodically or updated, and if they are not careful, mistakes made on one patient can propagate to hundreds of other patients. In response to this story, the story kind of went away after December, but the NIH brings it back into the forefront. And this week there was news that in the NIH hospital in Bethesda, they were going to start keeping track of how much radiation patients were getting with CT scans. I think this is a great idea. What the plan is they were going to log the amount of radiation from a CT scan into the patient's medical record and have that information follow the patient around as long as they were within the NIH system. It makes perfect sense that they should want to track this amount of radiation and give another tool for doctors and patients to make decisions about CT scans. I know as a medical oncologist, I'm ordering lots of CT scans for many different reasons. Many times we want to restage patients once they've completed their initial treatment, or let's say they're having a symptom that makes us concerned that the disease is coming back. So we send them for a CT scan, and a lot of times there's really no other way of measuring disease in patients on treatment for cancer. The other problem is, as a whole, we are using more CT scans than ever on a national or global basis. And so it stands to reason that we would need more information about how much radiation people are getting from CT scans. If you look at the graph of CTs over time, every year there's thousands of more CT scans being ordered. It's a useful test, but it also exposes patients on a national and international basis to excess radiation. The funny thing is, if you ask radiologists how much radiation does a patient get with a CT scan, you won't get such a good answer. I've asked this to multiple different radiologists. And in fact, I asked myself this question. A patient actually came and said she would not, under any circumstances, get a CT scan unless she knew exactly how much radiation she was getting in the scan. So I looked it up. And actually, I was very pleased with myself for finding the answer. It was in the New England Journal of Medicine, of course, a 2007 article that looked at different scans and how much radiation was averaging in each one of them. The answer is actually variable because, as we said, there's different techniques and different patient sizes, so you have to adjust the dose. But by and large, the amount of radiation is quite a bit. And compared to, let's say, a single chest X-ray or, let's say, a transcontinental plane flight, it's substantial. And then when you start talking about multiple CT scans, it's not an inconsequential amount of radiation. So the net result here is I think NIH is doing a good thing in being a leader in drawing attention to the amount of radiation patients are getting with scans, and I think the rest of us could follow the good example they set. For InteractMD.com, this is Dr. Michael Benjamin. Thanks for listening.